During a vaginal birth, it's very common to experience grazes or tears to the labia, the upper part of your vagina, the more frequently to the perineum, the area between your vagina and the anus. However, most of these tears are minor and the injuries will heal quickly without causing you any problems. The perineal tears come in 4 categories. There's a first degree that just involves the skin. There's a second degree that involves skin and some of the muscle. Both of these you may be offered some stitches to help with the healing. Third and fourth degree tears are a little bit more extended, the tears that go down into the muscle that controls the anus. These tears are known as OASIs, obstetric anal sphincter injuries. They occur in 3 to 4 in every 100 births and they require specialist repair by a senior obstetrician. Most women who have these tears recover well, although it can take some time. However, occasionally women can have long-term pain and difficulty or inability to fully control the bladder, the bowel or control the passing of wind. There are higher risk categories such as carrying a large baby for over 9 pounds, rapid deliveries, if your baby's head is born back to back or in the face-up position, being over the age of 35, if you have a delivery assisted with ventouse or forceps, or if your baby's shoulders get stuck behind the pelvic bone, this is known as a shoulder dystocia. To reduce the risks of these tears, we advise perineal massage with a natural oil such as coconut or almond. It's recommended from around 35 weeks pregnant until birth. The idea is that massaging and stretching that muscle makes it more flexible for the birth of your baby. More information on how to do it can be accessed via the RCOG. Warm compresses and a heated towel and a pad that can be held against your perineum during the pushing phase of your labour. The heat helps the perineum to stretch as the head is delivering. The birthing environment is very important to create a relaxing atmosphere with mood lightening, soothing sounds and relaxing smells. Remain active in your labour and choose positions that are most comfortable for you. The midwife will advise a slow and guided delivery of the baby's head. The OASI Care Bundle is a set of 4 practices that when applied together has proven to reduce the risk of extended tears. Your midwife or doctor will discuss extended tears with you and how to reduce this risk of this occurring. So with your consent, the midwife or doctor will support the perineum and during the birth of the baby's head and shoulders and encourage a slow and guided birth. During the birth, you may need an episiotomy, which is a cut through the vaginal wall to make the space for your baby to come out. Your midwife or doctor will ask you for consent to do this and will make it painless as possible by injecting the area with local anaesthetic. Finally, after the baby is born, your midwife or doctor will ask you for consent to examine your vagina, the perineum, and the anus to ensure any tears are identified and treated appropriately to avoid any further consequences. If it happens, what support is available? So we've discussed the risks and how to avoid them, but unfortunately these tears can still happen. Should this happen to you, we have a perinatal pelvic health service to provide follow-up care up to 12 months postnatally. It's a combined clinic that will support your recovery by assessing the healing of the wound, discussing and assessing with our specialist pelvic health physiotherapist and specialist pelvic health midwife to discuss the pelvic floor exercises in future pregnancies and follow up with other departments should you require them. So the main part of all this is that it's okay to talk about it. A lot of women experience pelvic health issues following childbirth and the adverts for incontinence pads seems to give the impression that it's normal and it should be accepted. This really isn't the case. There are self-help techniques and resources to support you, and if you feel they're not making any difference, you can access help from your midwife, health visitor, GP or self-referral to the Perinatal Pelvic Health One-Stop Clinic. This can be a complication of pregnancy and childbirth, but it's not normal and it can be treated. The help is out there.
My name's Maeve, and in June 2022 I had a 3rd degree tear after the birth of my first daughter. During the 2nd stage of labour, the baby got stuck and I was having trouble pushing, so after 4 hours I was taken down to theatre for emergency forceps. They gave me an episiotomy which extended into the 3rd degree tear. The recovery process was quite long and arduous. I found it very tough. I dealt with a lot of bladder and bowel incontinence and a lot of mental health struggles such as postpartum anxiety and depression and flashbacks in the form of nightmares as well. My recovery length, it took around 16 to 18 months. That's when I finally stopped feeling pain in my scar site every day. My bladder urinary incontinence felt a lot better after 12 months and the bowel incontinence was quite short-lived. I had a lot of help from my family and especially my partner. I got in contact with other women. I think when my baby was around 6 to 9 months old, I found the birth care support group on Facebook. I also found about the charity MASIC, and I was really glad I found it, as no doctors or midwives had told me about it. I had to find it myself, but it was nice to find other people going through the same experience as me, and gave me a lot of validation that I wasn't being over dramatic or going insane. The types of support I got a lot of support for my mental health and my physical health. I had birth trauma therapy. I also had a lot of pelvic health physio, especially controlling my pelvic floor muscles and help with diastasis recti, as I had a severe case of that as well. I also had the anorectal test at 9 months postpartum to assess how my scar site had healed, and that determined the best course of action for me was an elective C-section if I did get pregnant again, which I did choose. I did get pregnant again when my daughter was 18 months old. I was 18 months postpartum. I gave birth to a little boy through a planned C-section in July 2024. It was a lot calmer, a lot more controlled, and definitely what I needed after having such a traumatic birth the first time. My advice to other women would be to always advocate for yourself. You know your body best and you know what's right and what's wrong, and to make sure that any care you get is of high quality and that healthcare professionals are educated in your birth injury and how to treat it best.
Following an obstetric anal sphincter injury, you will be referred to see a pelvic health physiotherapist. Pelvic health physiotherapists are specialised in the care of conditions related to pelvic floor dysfunction. This can include problems with bladder and bowel control, sexual function, and pelvic organ prolapse. This is the downward movement of one or more of the walls of the vagina. After an obstetric anal sphincter injury, you will receive a telephone call from a pelvic health physiotherapist at 2 weeks, and then you'll have a face-to-face review at around 6 weeks postnatal. During this assessment, you will be asked about your bladder and bowel function, symptoms of prolapse, and any ongoing pain you may be experiencing. This appointment is an opportunity for you to discuss any ongoing symptoms or questions you have. Your physiotherapist will make a treatment plan to address any symptoms you have and direct you to appropriate services that may be able to help with any other concerns. A small amount of women will experience difficulty controlling their bowels or holding in wind after an OASI injury. You will get ongoing support from pelvic health physiotherapy for this. You should also be referred to the one-stop OASI clinic, which may be between 3 to 6 months after your birth. It is an important clinic appointment to keep. A gynecologist and a pelvic health physiotherapist usually run the clinic. You will be offered an examination to check the wound is healed. You may also be offered tests carried out during the appointment. These tests may include an endoanal ultrasound scan. This test looks at the structure of the muscles in your back passage and can check for changes in the muscle. You may be offered another test to see how well the muscles can squeeze. You will be given the results of the tests on the day. You can have a discussion with the gynecologist about any future births and what may be suggested given your test results. The pelvic health physiotherapist will be able to progress your pelvic floor exercise plan and discuss any changes to treatments required.